Hi everyone, Big Papa Scott here, doing a little more about the heart. I figured we'd talk about a heart attack. As serious as a heart attack, as they say. The reason why I wanted to cover this was because it is one of the more common things people search for on the internet, because they either have a friend or a family member or even themselves and they have a heart attack, and unfortunately a lot of times it's not explained well, and I'm hoping that I can do that here for you. Now, this picture that you're looking at right now is a slice through the heart of the left ventricle, which is right here, and the right ventricle, which is over here. So these are the two main pumping chambers. Most heart attacks will affect the left ventricle, almost always. They can sometimes extend a little bit into the right ventricle, but almost always it's the left ventricle. Now, you can see on this image that up here in this area there looks to be what seems like some blood clots and some bruising or something of that nature that would lead you to believe that there's something going on there, and you would be right, because that's the myocardium, or the heart muscle, and that's what it looks like after a heart attack happens. The main thing, though, is that that area, instead of moving up and down like this, and all the other areas that move inward to pump the heart, or to pump the blood out of the heart, this area will either not move as well or not move at all, and in some cases can even move in the opposite direction, which is really bad. If a heart attack happens, it's a definite emergency, and I want to give you people out there some information about a heart attack and some of the symptoms. Chest pain that lasts for any more than, let's say, 3 to 4 minutes. Most of the time the chest pain, when you get it, you know you're having a heart attack. It's a severe pain. It's been compared to childbirth. I haven't gone through childbirth, although I watched my wife nearly break all 4 of my fingers while she was holding my hand during childbirth. So I'm assuming it hurts pretty damn bad. But anyhow, this is considered to be one of the things that people will know that they're having a heart attack. The pain is so bad. It can be a lot of pressure, a lot of pain. You can get very short of breath very suddenly. There's a lot of other symptoms, like you get pain down your left arm. That's the main one, pain down your left arm. So you'll have chest pain and pain down your left arm. Sometimes you'll have a little bit of pain on the left side of the neck and the jaw. You can have that too. That's part of the symptoms. But that's an emergency situation. If you get to the hospital in time, and by the way, don't drive yourself to the hospital. If I have to say that one more time in my life, it's an ambulance ride. You know what? You'll figure out a way to pay for it. It's just the way it is. You have to get in the ambulance because this is an emergency situation and your heart could stop at any moment. If you drive yourself to the hospital, there's a good chance you're going to put that car in the ditch because you're unconscious and dying right there. So get in an ambulance, let them take care of you, because if your heart does stop, they have ways of bringing you, trying to bring you back. So call an ambulance. Again, the heart attack is something that you really, really need to get to the hospital for as quickly as possible. They can sometimes open up the vessel that's blocked in the cardiac cath lab, which allows them to kind of get into the artery and open it with what's called a balloon angioplasty, and there's a stent around the balloon, which is just like it's a metal cage that kind of holds the artery open. and it works extremely well, and it's a lot better than having open heart surgery. And if you get there fast enough, then the heart muscle won't die. It'll come back to life, basically. The heart muscle is pretty resilient, so if it's starved for blood and starts to damage itself, it can repair itself a little bit if you get there fast and have them rush it to the cath lab and do that angioplasty stent placement as quickly as possible. So in this view, you see the myocardial infarction starting. The function of the heart would probably be bad, and then of course, you're going to have all the symptoms of a heart attack. Now, the next thing I want to show you is what happens to the inside of a heart or a vessel. Can be anywhere actually in the body, but let's say right now it's in the heart. So let's draw an imaginary heart vessel here, and you can see it here. It's a nice pretty vessel. And what happens a lot of times is, over the years you can develop what's called plaque. And plaque is a combination of a lot of different things. It's a fatty substance with some hard substances like platelets and things like that going through your system. It's not always from eating poorly. It can be heredity. In fact, they're finding out more now about heredity being the chief factor. So one of the things I can tell you that might help is that if your father had a heart attack at 40 and your grandfather had a heart attack at 50, guess what? Yeah, you need to go see a cardiologist and see what your cholesterol is, because if your cholesterol is extremely high, they can treat it and you won't have a heart attack at 40 or 50. And back then they didn't save people, they died, unfortunately. So why not take care of that problem now by getting on some cardiac medicine that will help reduce the amount of plaque in the system. Now these plaques, they just kind of gather as time goes on, and they usually gather right in the same area. And as time goes on, they get more and more narrowed, and maybe right about there you would start having some symptoms, because if the blood is flowing this way, you can see that there's a very narrow area that the blood can go through, which means, let's say down here is heart muscle, right down here. This part, this heart muscle here, is starting to get starved with not having enough oxygen. So that's a terrible, I can't write with this pen. It's getting starved with not having enough oxygen and not having enough blood flow. So you may start having symptoms, and if those symptoms start, it's time to get to the hospital. Eventually what happens is this whole blockage here closes up. And if that happens, then you will definitely lose this part of the heart. You will have a heart attack. If a doctor can get to this right away and open it up with one of those stents or balloon angioplasties, I'll show you a picture of that in just a minute. There's a chance that you can get back that area that is not working well because of the heart attack. But it has to be done almost immediately within 20 minutes or so if they can do it. And hopefully you won't be alone in the house when you have the heart attack, because that's not a good thing to be, is alone. So anyhow, this is one way that a heart attack happens. It, a little bit of the narrowing keeps going on, and then eventually a little piece breaks off and kind of occludes the whole artery or narrows the artery enough where no blood can get through. So that's one way of having a heart attack. Now another way of having a heart attack is by having that same narrowing going on in the vessel, and then for some reason, and they really don't always know why, but your body will produce a small little clot If the blood's flowing that way, when that clot hits this part of the blockage, then all that blood flow that's supposed to be going to the heart muscle down here is now not doing it. So that little clot can be dissolved with blood thinners. There's special names for them, different types, but ultimately what they do is they bring a catheter in to this part of the vessel and they release this medicine in, and it dissolves the heart, dissolves the clot, and then they'll go in with a stent and open this up. So that's another way to have a heart attack, is with a blood clot going to that blockage and stopping blood flow from going through. So they can dissolve the clot and then put a stent in. You'd be okay most of the time if you got there on time and didn't wait. I have a brother-in-law who did that, and now he did have a heart attack, and that's not good, but he's okay. It's just that it was quite a fight to get him to go to the hospital. So don't be that way. Anyhow, this is one of the ways that we take care of those blockages. This is called an angioplasty with a stent placement. Now you can see on this first slide, this is kind of what I drew earlier, and you can see the blockages right here, both places, and you can see the blood cells just barely getting through there. So what they do is, in the second B here, they slide a catheter up, and you can see that's represented by this white, it's actually a balloon. It's kind of surprising, but it is a balloon. And what it does is it inflates, and here in C, you can see that it's inflated and there's a steel cage around it, and it opens up and stays open once it's deployed. So that's what they call it, stent deployment. And what it does is it kind of pushes the plaque down, compresses it so that blood can flow through really well. And then tissue grows over that cage, and everything is hopefully taken care of. There is some complications with these. Occasionally you'll have a blockage that'll develop just after where the stent's deployed. You can't really see my drawing, or right before where the stent's deployed. That does happen occasionally, and then you have to have another one put in. But for most people, this one stent will work out just fine to open up the heart vessel, and from that point, they'll put you through some cardiac rehab, and you'll do just fine, and you'll avoid having a heart attack, which is the best bet. If you can get there before the blockage is complete, I tell you, you have done yourself a real wonderful thing, because once that thing is completely blocked, you can go into a bad heart rhythm. You hear them say it on TV, VTAC or VFib, which is, the heart beating very irregularly or beating very fast and from the bottom of the heart, which it's just not sustainable for life. So they eventually, if they can't bring you back with the shocking paddles, or we don't use paddles that much anymore. We use electrodes on the back and the front, or on the two places in the front of the chest. So if they can't bring you back with that, then I'm afraid you're upstairs talking to Elvis, if you know what I mean. But they bring you back and they can get you to the cath lab, get that stent put in. You might do okay, but you might still have damage. That's why it's important to get there when you're first starting to feel symptoms. Let's say you're outside shoveling dirt, you're fixing up the garden or something like that. And, after the third wheelbarrow full of dirt, you start to feel this chest pain, and you notice the pain is kind of going down your left arm. And if you stop and rest, that pain goes away. I got news for you. You're on your way to a heart attack. So let's take care of that problem and get yourself to the hospital so that we can fix it. And that way you get to see all your grandchildren and everything like that when you get old. So anyhow, This is the main thing I wanted to talk about in this video, so I kind of think I've gotten to that point. So the next one, I'm not sure what it'll be on, but it'll be soon. We'll talk to you later.